so let's go on to question number 2. So this is a pharmacology question. We have a client with hypertension who's taking lisinopril, and we're being asked which of the client findings is most concerning. So again, this is another prioritization type STEM. So we're saying all of these are going to be concerning, right? But which is the most concerning? So if we're asking which is the most concerning, what are we looking for? The one that has the potential to be most life-threatening, right? So let's do a little brain dump, and you guys can help me with this. So what do we know about lisinopril? This is a ACE inhibitor, right? Angiotensin converting enzyme inhibitor. What do we know about ACE inhibitors? Does anybody know? What are just some common side effects in general to antihypertensive medications? Well, we know that they're used to lower blood pressure, right? If it's too high. What happens if we lower blood pressure too much? A lot of clients end up with what we call orthostatic hypotension, right? So blood pressure gets low when they stand up. It can make them dizzy. So we have to tell them to stand up slowly and change position slowly. Oop, I see someone says coughing. Yep, that's a common side effect. Is that usually life-threatening, or is that just an annoying side effect? Yeah, it's typically an annoying side effect, not typically life-threatening, right? What do we know is a big concern with this medication class? What's a life-threatening concern that can happen? Angioedema, we worry about, right? Because that is swelling in the face and the neck. And then what do we worry about if we have swelling going on in this area? Airway obstructions, right? So if we have swelling of the lips and the tongue and in this area, we worry that it could obstruct the airway, right? Which we know, if we go back and look, is going to be our highest priority, right? So let's take a look at our answer options. We already know quite a bit about ACE inhibitors already, so let's see if we can use this to answer our question. So option number 1 is itchy lips and tongue. What might that be a sign of? Yeah, that might be a sign of angioedema, right? Because if their tongue is itchy and their lips are itchy, that might be because they're swelling, right? So that would be pretty concerning, right? Because like we said, we're worried about airway because swelling of the face could lead to an airway obstruction. I'm thinking that's probably most concerning because we know airway issues are a big deal. But let's take a look. We always want to read all of our answer options because we want to make sure we're not missing anything. Okay, a persistent dry cough is number 2. Well, we already said that that is a common side effect. And while it's concerning because it can be an issue for clients not wanting to take this medication, it's not typically life-threatening, right? So I'm going to say that's not my most pressing concern at the moment. How about a blood pressure of 142/92? Is that normal? No, it's not normal, right? But is it a hypertensive crisis? No. It's high. It's higher than I would expect to see for somebody who is being medicated for hypertension. So that might be a sign that the lisinopril isn't working so well for them. Maybe they need a bigger dose, or maybe they need a different medication. But is this blood pressure life-threatening? No, right? So not my most pressing concern. And how about feeling lightheaded when standing quickly? Is that a pressing concern? Well, we already said orthostatic hypotension is common. And so feeling lightheaded when they stand quickly is probably a result of that blood pressure going low, right? And that can happen with antihypertensive medications. And so we need to educate them, right, to change positions slowly, to stand up slowly, not come bouncing up out of their chair really quickly because that will increase their risk for falls, but definitely isn't going to top a potential airway issue, right? So I'm still liking number 1 as our answer for most concerning. What do you guys think? I see a lot of number 1s. Yeah, okay. Let's take a look and see if we're right. And yes, we are correct. Itchy lips and tongue, right? Because we said we were worried about angioedema, which can be an airway obstruction. And we know that airway obstructions are always going to be a really high priority concern, right?